Hi, I'm Danielle, and I will be speaking on Alzheimer's disease. Alzheimer's is defined as a chronic condition characterized by progressive, irreversible decline in mental ability, accompanied by changes in behavior, personality, and later on in the disease stage, motor function. It is considered to be the most common form of dementia. Of all the dementia cases that are out there, it accounts for 50 to 70% of those cases. It affects both men and women over the age of 65, although there has been some cases where the person affected has been in their 40s and 50s. The most important risk factor for developing Alzheimer's is a family history of it, or having Down syndrome, or having Parkinson's disease. There has been a study where they have linked a gene mutation on chromosome 1, 21, and 19 that is linked to Alzheimer's also. There are 10 warning signs or symptoms accompanied with Alzheimer's that can be memory loss that disrupt your life, difficulty problem or solving, forgetting how to do actions that you've normally didn't have a problem with before, getting lost in familiar surroundings, vision problems, speaking and writing issues, misplacing items, lapses in judgment, withdrawal from usual activities, and changes in your mood or personality. There is considered to be 7 stages of Alzheimer's from mild to severe. The first stage is there is no decline in function and it cannot be detected in any exam. Stage 2, the patient is functioning normally, but is starting to notice some signs of forgetfulness, and they may attribute that to, oh, I'm just getting old. Stage 3, not only does the patient notice changes, but the family and friends start to notice changes also in the memory and the behavior of the patient. They may start to forget names, have difficulty organizing and finding the right words to say in conversations. Stage 4 is when Alzheimer's symptoms are apparent and they can be detected in exams. The patient will show difficulty with short-term memory. They will need assistance with like balancing a checkbook or just any simple like mathematic functions. At stage 5, the patient will need help making just everyday personal decisions like what am I going to eat today or what am I going to wear. The patient will need help with that. At stage 6, this is when the patient will need assistance getting dressed, going to the bathroom. They may develop urinary or bowel incontinence. And at stage 7 is when it's very severe. The patient will have no, very little vocabulary. They won't be able to hold a conversation or even sit up in the chair. They have lost that function. To be diagnosed with Alzheimer's, it's a very lengthy process. You would have to go through many tests. You would have to do a complete physical, a complete medical and family history would have to be taken. You would have to um, divulge if you have alcohol use. There's a lot of medications that are out there, both prescribed and over the counter, that bring on Alzheimer's like symptoms. So those would have to be divulged also. CT, MRI, and PET scans are the modalities of choice that would detect Alzheimer's disease. There is no treatment for Alzheimer's. The most that a patient can do is to relieve symptoms, is to take vitamins that can help with memory. Have a nutritious diet that have those vitamins in there. They can go through therapies. They can do vision therapy, light therapy, dance therapy. This would all help like their mood, to not have them be agitated or depressed or just lift their mood and help their memory along. Um, there since there is no cure with Alzheimer's, the disease just progress, and it will uh, progress up to the stage of death. Actually, the eventually the loss of brain cells